Okay, hey class. At the same time, there are other factors that determine student success in school. I'm still waiting for a book to be written. I spend my high school years depressed, something to which a lot of students could relate. One is simply suffering from clinical depression. Oftentimes, frustration between teacher styles and student learning may worsen symptoms. There is help for those 5 to 18 years of age who are depressed. This sample includes a variety of children. The question that the medical professionals asked here was, although serotonin has been shown to be a safe drug which may be administered to withdrawal children who have been diagnosed with such depression, some children may potentially be at risk of withdrawal issues when using the drug, according to an article in The Lancet and a report done about 6 years ago. For fluoxetine, the study identified 2 published random control trials providing data for 315 participants diagnosed with major depressive disorder aged 7 to 18 years. Fluoxetine was more likely than placebo to bring about remission by the end of 7 to 8 weeks of treatment. All teachers should work with their school nurse, listen, this is very important, in order to better know their students' medical history. Okay? According to Mary Floorhead, the model of learning known as Bloom's taxonomy suggests that there are basic domains or classifications for thinking behaviors important in the process of learning, which include 1. Cognitive knowledge-based content, 2. Affective attitudinal-based content, and 3. Psychomotor skills-based content. The cognitive and psychomotor classifications are broken down further into 6 more levels, but we're going to concentrate our time on the affective content, which only consists of 5 subcategories, but that's neither here nor there. This deals with our emotional feelings, values, appreciation, enthusiasm, motivations, and attitudes, according to a man named Don Clark. I found it interesting that here motivation was described in terms of a satisfaction in responding. The research showed that any teacher is able to force a response out of their class. A variable is that the teacher with more college hours in his or her content area even went on to say in the study that their students were willing to respond. In that instance, we could say that the students are more than just compliant in their response. The expert teacher, though, has students that are satisfied in the study. Would it be that this would be the norm, to be satisfied with yourself in a given study? The researchers did warn that the result of the test may be inconsequential because the sample included novice as well as seasoned teachers. Zeidner asked the question, are there other factors beyond a teacher's control in 1998? He posed that question. These factors may include, but not be limited to, anxiety, a natural human emotion. Okay? The study showed that anxiety may be heightened due to 3 or more factors outside of the school-controlled or manipulated environment. Educators that were shown to take time to encourage parents to create an environment in the home foster an environment where the children were more likely to be well rested during regular school days, maintain a healthy diet, and 3, exercise on a regular basis. Okay? And that, according to an Eric Digest that addressed this issue, this took place at a larger metropolitan setting. So, in short, we have looked at, in an informed way, that practically speaking, different teachers teach differently, according to the research that has been done regarding teaching style. We have also learned that teachers should vary their style depending upon the concepts being presented on a given day. In our quest to motivate our students, we must balance the fun within the context of a good and clean learning environment. We should feel free at school to work with a school nurse in order to maintain a good relationship, so if there are signs of withdrawal attending medications, we will have been proactive and will stave off tragedies that may occur when we otherwise know less than more about a particular student's depression symptoms and diagnoses. We need to keep an open dialogue as well with our parents regarding their child's home environment and make sure that it works well with what we are trying to accomplish at school. Lastly, we must not settle for forcing our students to respond to the material. We must keep trying until every pupil's response is satisfactory to they themselves as well as to us. Then and only then will it be said of us that we are motivators of our high school students. You are dismissed.